Hello, and welcome to PK's webinar on technology for healthcare operations, co-hosted with Nuvolo. I'm Elizabeth, and I'm part of PK's marketing team. Before we get started, I'd just like to remind everyone that all attendees have been muted. We will, of course, be recording this webinar for future reference, and we absolutely encourage all attendees to leave any questions in our Q&A tool on the Teams platform. Hopefully we have some time at the end to answer them at the end of the presentation. So at this time, I'd like to hand things over to Dustin Smith from Nuvolo and Brian Blakey from PK.
Thanks, Elizabeth. I'm Dustin Smith. I am a senior solution consultant with Nuvolo. I've been with Nuvolo since really the beginning of this year. Prior to that, I spent almost 14 years with Intermountain Healthcare, where I held a variety of analytics and operations roles. And my last role there was the Director of Healthcare Technology Management Support, and I am a certified healthcare technology manager. Brian.
All right, thanks Dustin, Elizabeth, and thanks everyone for joining today. I'm Brian Blakey, Director of PK ServiceNow Nuvolo Center of Excellence. I've been with the PK organization for almost 4 years now, serving in a solutions architect role and currently director role. Before joining PK, I served in several IT management roles and was also the program manager for numerous ServiceNow, ITSM, and compliance initiatives for organizations across several industry verticals. Really excited to share more info today with you about Nuvolo and PK. Back to you, Dustin.
Thank you. So the connected workplace for healthcare, ultimately, what are we talking about? And so the agenda that we're going to go through today is connecting those different support teams and then really understanding what a single platform for all of those support services can do. And ultimately, what are the benefits of having that single platform that we call the connected workplace? What are the benefits of that in healthcare? And then we'll transition to really the better together story of PK and Nuvolo, and what are some of the implementation service offerings from PK. And then we'll finish up on questions and answers. So again, going back to who are the key teams supporting hospital operations? Well, first and foremost, you've got healthcare technology management. Who are the engineers servicing your medical equipment? Who are the directors ultimately guiding those engineers? And how are they supporting others? Then you've got facilities management. Who's taking care of a lot of that fixed equipment that also really ultimately supports that medical equipment and also supports those clinicians? Then you've got information technology. Who's supporting really your information systems, not only architecture and infrastructure, but also the hardware associated with that. And then you've got some ancillary groups, really your capital equipment planning and finance, evaluating the efficacy of the way you're managing your operations. And then you've got really your customer, a huge portion of the time, the clinical care departments, those clinicians that are ultimately, they're doing the best they can to serve the patient. And they're trying to do everything they can to not focus on some of these other activities. So within a hospital environment, there's multiple systems that these different groups are working on, and we're really taking this from the perspective of those support groups. So within healthcare technology management, you've got a computerized maintenance management system, a CMMS, that is really holding all of that device information, and that's the way you're going to ensure that work gets routed to the appropriate engineer, and that when it comes time for a compliance audit from Joint Commission or DNV, you have the appropriate information you need to defend yourself. Well, then if you go on to IT, they've got IT service management. They're tracking their tickets in really a potentially different system. Then you've got facilities service management. They may be in their own independent CMMS, but it isn't sitting within the same architecture as healthcare technology management. And so if you've got a boiler that is related to a sterilizer, or maybe a chiller related to a CT, those can be disparate data systems. And then last, you've also got cybersecurity monitoring. How's your SOC managing threats and vulnerabilities, and how does that impact the other groups? If a medical device needs patching because of a threat or a vulnerability, how's that information going to get back to healthcare technology management? Well, the good news is in working with Nuvolo and the Now platform, you can really have it all. You can have a singular platform that really impacts all of those support groups, and it makes it that much easier to be able to pass tasks and work orders really over the fence to these other groups that are already doing the best they can to collaboratively work together. And this is going to create a unified experience to really the clinicians and any employee that needs specific work performed by those support groups. And this is huge. It can really kind of open the door to new opportunities that you haven't had in the past. Really, we've got HTM operations, facility services, operational technology, your cybersecurity management, and IT service management. They're all together, and it's really one bucket that you can allocate very easily from. So let's talk through an example. Right now, if you aren't working on really a connected workplace platform, if an issue comes in, for instance, on heavy iron, you've got a CT device that goes down or an MRI, there's a huge, really, it can come from any area. Maybe you've got a chiller that's down. Maybe something specific's going on with the MRI. Maybe you've actually got a workstation that's gone bad. Really, that's 3 different areas where work can come in. And so when it comes in, you've got a maintenance event from one specific area, here on an error on data scanning to a backend server. Is that going to go to IT or HTM? In this example, likely it goes to IT. So you've got IT shows up, they look at the workstation, they realize that it's actually something specific to the MRI. Well, the problem then becomes, how are they going to pass that information back to healthcare technology management to get this resolved? Where can you easily push it from one area to another? And often it becomes a matter of phone tag at that point. And then even once HTM shows up and they work on the device, there may be other groups that need to be involved, and you may need to be able to pass that information back. And this is where we come to, what's the solution? Ultimately, it is a connected workplace. We want the ability to easily pass that over the fence, regardless of which of the 3 areas it came in from. We want to be able to quickly look at that. And a good thing we can do, if we understand in advance, maybe that there is going to be FM related to this. Maybe there's some work that needs to be done on the chiller. Or we want IT to come take a look at the workstation as we're bringing the device back up. If it came into HTM, we can actually put those as tasks on the exact same work order because we're sitting within that singular platform. And this really enables success. And there can be huge benefits that come from this. And so when we start to think through the benefits, okay, we've talked about a better coordinated effort. What all is this going to do? We're going to improve patient care, ultimately, business operations, and cost savings. So what are some of the specifics about that? As we talk through remediation and response time, by enabling us to be able to get all of the groups there at once, I'm actually preemptively getting ahead of those challenges. For instance, if with that CT or MR that went down, if I'm automatically going to give facilities a heads up and give IT a heads up so that we're looking at that workstation, then they're going to arrive probably around the same time as really our clinical engineer. And because of that, it's going to be up that much faster because you've got all 3 groups in a coordinated effort to resolve the particular issue. And that faster remediation is going to lead to improved uptimes. And your improved uptimes, as we start thinking about cost savings opportunities, we're also going to increase revenue. How much revenue do you lose anytime a CT or an MR goes down? Really, the impact can be incredibly painful, especially if you have an imaging center. And so not only are you saving money, but you're also increasing revenue. This also gives you clear visibility, and you're able to have reports available in real time. You're no longer waiting until really the end of the week, or you're not having to look through multiple systems to understand what all happened with this MRI, what groups were involved in getting this device back up. All of a sudden, it's all housed in one location. Also, improved cybersecurity. Threats and vulnerabilities are consistently coming out really on a daily basis. And being able to have some of that information that historically was really split between IT and healthcare technology management, having that be able to come directly into the CMMS can lead to really all of the benefits that we see in front of us. And then we've also got the capability to do more process integration with different systems. There's an open API. And so really, you can connect with anything else that has an API. So as we talk through the connected workplace for healthcare, I want to really define it within Nuvolo. Within Nuvolo, we have solutions for maintenance, and that's really going to be both the facilities side of the house and healthcare technology management, and really your work order system, understanding your device inventory. And then you've got space. What do your hospitals look like? What do the assignments of individuals look like? You have projects, which you can utilize for capital planning. Real estate, lease management, how are you utilizing your space? Are you actually really selling some of your spaces to others? And then sustainability. What does your utility usage look like? And what efforts are you going through to try and make your facility more and more green? And then all of this is really engulfed by our operational technology cybersecurity solution. Let's make sure all of your inventory that sits within facilities and healthcare technology management, we're monitoring really those MAC addresses and the devices to ensure that if threats and vulnerabilities come through, they're remediated. And so we're truly connecting support teams, locations, assets, and business services on the same platform, which is leading to a more collaborative and coordinated approach that is ultimately improving your clinician and employee experience and enabling better tracking and reporting so that you can better manage your business. And with that, I'm going to go ahead and turn it over to Brian to kind of talk about how this works really with PK.
All right, thanks so much, Dustin. Some great thoughts on improvement opportunities. So with PK's work in the healthcare space, partnering with Nuvolo, we've helped several organizations quickly realize value from Nuvolo solutions on the Now platform. One of the examples that you see here around what Dustin noted earlier is large healthcare providers' efforts to consolidate multiple legacy systems, data, and processes using Nuvolo and PK services. This project included implementing several Nuvolo apps in multiple phases, as well as data migration, integration, and automated testing services to go with it. So all of this was leveraging Nuvolo on Now to provide a single source of truth with numerous service efficiency and compliance improvements along the way. So another recent example is a healthcare services organization in the Western US. The PK helped with deploying the first phase of Nuvolo applications and related processes in less than 8 weeks from initial kickoff, providing some immediate value and return on investment for that organization. So that effort involved close coordination with an existing ServiceNow platform and service management scheme, and compressed the time to value and overall benefits. A few quick notes about PK's service offerings around healthcare and Nuvolo, which help make some of these successes possible. PK provides a variety of technology and consulting services to healthcare with experienced practitioners to help transform our clients' environments. We're also a premier services partner with both ServiceNow and Nuvolo, with numerous client projects across a variety of industry verticals over the last 5 years, all with high levels of customer satisfaction. So PK also offers comprehensive implementation services for Nuvolo product suite and ServiceNow. We've got a quick delivery framework and essential extras like integrations, data migration, service automation, as well as automated testing services that can benefit many organizations. So we're really excited about our partnership with Nuvolo over the last 1.5 years, which is focused on jointly assisting healthcare organizations achieve both rapid and sustained value from Nuvolo Connected Workplace solutions. So with our experience in this space, PK's identified some best practice themes that lead to success on Nuvolo and similar projects. We'd like to share some of those with you today so you can start planning ahead for your transformation effort. Most importantly, with Nuvolo on the ServiceNow platform, there's an extensive set of technology capabilities that you can use to enable a single source of truth across clinical, IT, facilities, security, and other service teams within your organization. As Dustin noted earlier, the integrated service model presents many opportunities for coordination of service offerings, process workflows, service management themes, all incorporating IT as well as OT, or operational technology asset and work processes. For all of these projects, we would suggest that the broad scope of service modernization and automation opportunities should be considered from a strategic perspective to help improve your user experience and your organization overall. It's a perfect time to rethink how you're engaging internal customers and stakeholders for the services you provide, which can increase benefits and customer sat. One technique that we found to be useful is to leverage key concepts from some of the successful service models like ITSM and ITIL that you may be aware of to improve consistency. We found that can help fill in some of the gaps in some of the other functions that don't have well-defined process frameworks. We probably all realize that data is also an essential part of any asset management project. It tends to be one of the more challenging topics for organizations to handle. So we would strongly recommend allocating sufficient time from internal SMEs for things like data reviews, cleanup, normalization prior to migrating to Nuvolo solutions, especially if you're looking at consolidating multiple legacy solutions as part of your project. That really requires focus and coordination from the project team and something you don't really want to leave just to development resources. Another key area for enhancements in value is in compliance and standards. So Nuvolo and ServiceNow platform offer a variety of tools to facilitate those activities. Here we would recommend prioritizing your initial efforts on key requirements and known compliance gaps, leveraging some of the available Nuvolo features to quickly demonstrate improvements. And lastly, it's really important to break those larger implementation projects into multiple manageable phases to ensure success and start getting some of the benefits early in the program lifecycle. We'd urge you to avoid seeking perfection in those initial deployments and instead look at that 80 to 85% type solution so you can show some quick progress and value to your leadership team along the way. But in all of that, we would also recommend quickly following up with backlogged enhancements and a formal continual improvement program with assigned resources to make sure you're getting maximum value and benefits over time. So we hope some of these tips are helpful for your initiatives. With that, we'll turn it back over to Elizabeth to start the Q&A activity, and we've got a few minutes left.
Thank you,
Dustin
Brian.
and I are happy to answer any questions you may have, and we can also follow up outside this session for more in-depth discussions as needed.
Fantastic. Thanks so much, Brian and Dustin. Yeah, it looks like we've had a couple questions come through. And we have one participant wondering, is it best to approach implementation at once or phased for multiple sides of the house? Is that a best question for Dustin?
It's Brian. I can take that one.
Sure.
So, this largely depends on the scope of your project and how many applications and, what systems you're coming from. But, typically you want to break that project up into multiple phases, bite-sized pieces to help make it more manageable and also show some quick value from the product suite. Typically if you're going to be implementing Nuvolo clinical as well as facilities management and cybersecurity. You certainly want to break those into pieces. And then the other part to not forget about there is the data migration. Sometimes those can be challenging, especially if you're coming from a large number of systems. So it typically takes time to work through those. And in many cases, for a large organization, you may be rolling out to different regions, different groups of sites, and those can be broken up as well to make it a more manageable rollout.
Thank you, Brian. Appreciate that. And it looks like we've actually had a couple of different people inquire about PK and Nuvolo's expertise in regard to healthcare.
So I can start.
Yeah, go ahead.
I can start and then hand it over to you, Dustin, for the Nuvolo piece. So from a PK perspective, we do a lot of work for healthcare clients. And some of the areas that we've been focused on recently, in addition to Nuvolo, which we're talking about here, things like consumerization and loyalty, creating a seamless, transparent experience for consumer and care services, personalization of care experiences, modernization, getting more robust and scalable technology architectures in place, as well as optimization of those environments. Another area that we do a lot of work is in regulatory and compliance, to help organizations manage some of the current risks that are out there. Dustin?
Yeah, thanks, Brian. So Nuvolo, really, we were born and bred in healthcare. So we ultimately started out as a functional CMMS and really expanded our scope beyond there. And when you start to look at the individuals who are continuing to be brought on to Nuvolo, and I would argue I'm a prime example of this. We're constantly looking at subject matter experts within the industry that can really bring in that nice blend of vision in regards to where the solution can go. And then also the business practice. What have you done in the past? How have you managed operations in such a meaningful way? And you can really see that with individuals like Heidi Horn, our VP of Global Enablement in healthcare. She ran a large organization for a significant amount of time. And so she's been able to bring all of that expertise with her to Nuvolo.
Thank you, Dustin. And I think we actually have another question that might be most pertaining to you, Dustin. We have a participant asking, can we share the medical device cybersecurity partners that Nuvolo can integrate with? And this participant says that they're currently using Medigate at their hospital.
Great question. So one of the things I will say is, as far as the cybersecurity partners, really the passive monitoring suppliers, we are agnostic. But when I say that, there are some that we've already built, the pre-built integrations to really hit the ground running, and it would take a little bit less time to value in order to get them set up. Assembly, Order, Medigate are several that we've really built out that framework. So as you can see, Medigate is one of those, and it would be very easy to go through and put that in. As far as some of the others, we're continuing to build out those integrations. And so even if your partner is not on that list, it's likely work is still being done with them.
Great. One other question in regard to Nuvolo. Does Nuvolo tie into parts source for parts ordering?
Absolutely. So we do have an integration with PartSource. What's very nice about it is you'll literally go from a work order directly into PartSource and really the catalog experience that you've come to love over time. And there's a reason why PartSource is largely the biggest parts supplier within the healthcare technology management space. And we wanted to be able to keep that user experience. And so upon completion of that work order, the information would then be passed back into Nuvolo to go through the receiving process and actually get the itemized cost associated with the work order. So we have a very strong PartSource integration.
Thanks, Dustin. Fantastic. Well, I really appreciate your time, both Dustin and Brian, today. Would love to remind all attendees that we will be sending out a recap email that includes a blog post with a recap of the information we covered today, as well as a recording from the webinar for future reference. And we want to encourage any kind of further questions or inquiries to please contact Mark Closimo from PK with his contact information right up here on the screen. And we look forward to hearing from you again soon. Thanks so much. And we'll conclude the webinar today. Thank you.